My name is Felix Chan. I'm a gynaecological surgeon. I work at Adventist Hospital. Hysterectomy is a surgical procedure to remove the uterus. The uterus is located deep in the pelvis. Deep in the pelvis. In front is the bladder. Behind is the bowel. Next to it is the fallopian tube and ovary are major vessels and nerves of the pelvis. Hysterectomy is useful for the treatment of a number of gynecological conditions, including endometriosis, uterine fibroids, pelvic pain, pelvic inflammatory disease, and gynecological cancers. In assessing women's suitability for hysterectomy, we need to take a careful history, perform a careful examination, and perform appropriate investigation to define whether hysterectomy is necessary. Women have to make a major decision to have such operation. As a clinician, we hold responsibility to assess women carefully about the indication. Is there any other alternative other than hysterectomy? Once the decision's been made about the surgical procedure, it is the surgeon's responsibility to provide the best tool, provide the best outcome, which is safe, reproducible, predictable, and it's also affordable. In making assessment on patients who are having hysterectomy, rely sometimes performing examination, special CT scan, ultrasound to define the extent of this pathology. It could be endometriosis, it could be multiple uterine fibroid, or combination of conditions. Hysterectomy still plays a very important role for women who have suffered from heavy vaginal bleeding, menstrual disorder, pelvic pain, severe endometriosis, conditions which affects also the fertility. In hysterectomy, we make assessment to define which is the best surgical approach. Traditionally, I perform hysterectomy through an open incision. I'd perform through a vaginal approach. I perform standard laparoscopy called laparoscopic assisted hysterectomy with very good result. In the last 6 years, I've been using a new technology called robotic approach, which take me to a different advantage for the patient. Advantage to be able to operate with precision, to be able to deal with complex conditions, complex gynecological conditions, and still perform the surgery efficiently and minimize the risk and the complications, allowing safety for the patient. Patient can return to home within 24 hours. Nowadays, hysterectomy are performed as a day procedure. So women can have the surgery in the morning or the afternoon and go home later in the day. It's with this type of technology we'll be able to do that with confidence and safety. Women require hysterectomy often are very concerned because on top of making an important decision of losing the uterus, they also to worry about the safety, worrying about how they're going to recover from the operation. If I can provide patients with confidence, certainty that the surgical system will be helpful to them with their recovery, minimizing complications, trauma to other tissues, reduce bleeding, reduce the time they spend to recover, reduce the chance of reoperating, reducing chance of other complications, I think women will have confidence to go ahead with the procedure.